Anderson?
Yes.
Hi, my name is Leonard. How are you today?
Very good.
I don't want to touch you because you look so dirty, so I put the gloves on. You get that?
Yes. Every word.
Whatever word. Okay. How are you today?
Good.
I'm Dr. Burnett, medical assistant. I'm going to have you come out of that room. Okay. How's your surgery?
Oh, it seems to be healing really nicely.
Awesome, great. All right, I'm going to have you sit right here. We already checked your vital signs from earlier, right? Okay, cool. So just here to remove the staples. How does it look?
Not bad. There's no
Signs of infection? Okay. So let me set myself ready, okay? Alright, gloves. See, this doesn't look like this my glove. Now, in the clinical setting, this is not a great role model of setting you guys up because I'm not prepared for all the supplies. In the real world, you make sure that all the supplies are ready before you bring your patient in. Yes? That's the best practice. Now, again, the book says that you have to prepare all the supplies applying still technique. So what's in here is the staple remover, and it's sterile. And this can be used even in the real life situation. So, what we need to find out first is the doctor said the patient studying for post-op staple removal. We're going to remove there's a couple of staples there. There's like some that came off already on its own. Yeah. How many staples do you have?
5.
5. So it looks like 3 came off. So I'm just going to be removing the 2. Those are the hard-headed one, huh? Alright, so I want to check if there's any signs of infection, and it looks like there's no signs of infection because it just came off on its own, yes? And before you remove it, you look at it, doctor said, okay, well, you will document every staple that you will remove. Now, in some situations, the doctor or some clinics or policies, you might want to clean the area first, the incision site with betadine. If especially with the staples are stuck on the tissues, on the skin, you want to soften it up a little bit by either still water to clean it, soften it up, or betadine, depending on the clinic's policy. For this particular practice, we're just going to demonstrate how to remove the staples, okay? So here's your staple removal kit. Each one of you will have a chance to do this later on. And pretending that the patient had 2 staples that need to be removed today. I'm just going to demonstrate how to remove 2 staples, but just a step in how to perform it properly. Now you change your arm. What happened? You were white, you turned into pink. You love pink, don't you?
You're such a nice guy.
Oh, I know, me too. I love pink. Like pink berry. You like those? He doesn't know what I'm talking about. Okay. You know what pink berry means? Okay, so, yeah, those are like boba or something. Alright, we are going to open this. Make sure it's not expired. Now, sometimes they say, well, if it expired, they just throw it away, but sometimes they will use it. There we go. So even though it says that if this is sterile, you still have to practice the cell technique of touching. You cannot just touch the incision site with your bare hands, right? Right? So you guys can come closer if you want to and observe how to remove the staples. So I am going to try to remove a couple of staples just to demonstrate, and you guys will have a chance to practice it on your own in a few minutes. So here's the staple. It looks like this with 3 teeth. 2 what? 2 to the bottom would be the bottom, and 1 on top. So it's a tri-teeth kind of instrument or device. Yes. And what you do is just this is it comes automatically with a 2x2 gauze, and when you're removing it, you want to make sure that you inspect it for any signs of infection. If there's no signs of infection, then you will go ahead and proceed with the removal of the staple. So what you do, with the 2 teeth at the bottom, you insert it at the center of the staple, and then press. You'll see that the staple will automatically come off. And then save it on there. It looks like a butterfly now, yes? Do it one more time. Slowly, making sure that you don't push or don't force. Are you okay? Good? There you go. Perfect, Eric. So, There's one more left there. I'm gonna remove. Let's see. Okay. So for your practice, guys, I will only allow you to remove abnormal. Yeah. Any bleeding, any inflammation, and my observation, it looks really good. Yes. It's still open. Oh wow, it looks good. Let's put it up like that. So no, don't do it that way. Wow, it's open now. Okay. So when you're done, based on the doctor's instructions,
what if it has pus or
that signs of infection, then you need to alert the physician. Doc, it's infected. So do you want me to go ahead and remove? Obviously, maybe the staple is causing the infection. I don't know. So the doctor will make the determination. But the purpose of the visit is to remove the staples. Obviously, you have to follow the procedure. If it is impacted with what? Pus, and it's red, and it's inflamed, and it's hard to touch or warm to touch, and the patient screams when you touch it, then what you need to do is instruct who? The patient, okay, I'm going to talk to Dr. Bernard. I'm not sure if we will go ahead and remove the staples at this time. Maybe he's not ready yet. Okay? If it is really hard and it's stuck to the skin, don't force it, because it starts to bleeding, then you're in trouble. You need to alert the physician first. Hey doc, the staple is really stuck, it's difficult to remove. Do you want me to go ahead and remove it anyways, or do you want to remove it yourself? I said, oh, that's nothing, remove it. Some doctors, some surgeons are like really hardcore. Remove it, the skin will heal itself, yeah. Or the patient sometimes has what? Very sensitive reaction to any foreign body or foreign object, and that's why it's sometimes affecting them.
So if it does bleed, how do you clean it?
If it does bleed, then based on the cleaning procedure, normally you would just have to clean it with betadine or ointment, or also the doctor would say, you know what, wash it first with still water, and then put some apply some dressing or stir strip to continue with the closure of the incision, so that the incision will heal. Now, it all depends on the doctor's order again. You don't make the decision, the doctor will make the decision for you. Or they will instruct you, or he will tell you what to do. So if it is bleeding and it's difficult to remove, stop. Okay, you guys with me? Don't continue with the procedure. Alert the physician, doc, I cannot remove one of the staples because it's bleeding. It's starting to bleed and plus it's stuck. It's really hard. And the patient is screaming in pain. What do you want me to do? Tell them to stop the patient and go to sleep and remove it. Something like that. All right?
I have a question. So when would you use a stapler instead of
Okay, the doctor will use a staple depending on the procedure, on the site, and what it is exactly. Especially for like harvesting the varicose veins, or patient had some bypass surgery, so they harvest the artery here and transfer it here, and so that normally there's a lot of this long incision here. They will use the staples to hasten the healing.
and why not stitching?
Well, again, it all depends on the procedure. The doctor will make the determination. Stitches are for a small incision, but they have observable stitches and they have non-observable stitches, right? So if it is observable, you don't have to come back and remove it. Those are non-observable, obviously, you have to come back and remove it. And your job as a MA is to remove those stitches. Now, if this patient came in with staples, he just had a C-section. After the big long tummy right here. Wow, your stomach is very expanded all the way up. Okay, that's pretty much what you do, yeah. Okay? But the one thing you need to observe in MA is you follow the steps how to remove it. Don't force, don't dig. Yes, no digging. It's something like slide it under the staple and then squeeze. Are you guys with me?
The top part is doing the work.
Right. And this one is doing the work. All you do is just press the button. Or not the button, but squeeze the handle. The handle.
You said when you're taking off the instruments, they're sterile. So the gloves that you're wearing, those are not.
Yes, these are not
They're not sterile,
gloves. Yeah.
that's okay.
You're not touching and massaging the skin.
Right. Okay.
You don't need to put on sterile gloves for
No.
this.
Oh, good question. Any other questions?
How would you remove the non-absorbable?
How do you remove the, no, if it is non-observable in terms of the stitches, I will show you in a minute. This is going to focus on the staple first.
I had observable stitches, but my body didn't.
Absorb it. So you're here for stitch removal, right? Remove some of the stitches. I'm just going to do three. So there are different types of stitches. They have the run-on, they have the individual, which is some more challenging to remove. And what it is also the same packet or kit rather. It comes with a forceps and the scissors.
I'm watching your video camera.
I'm trying to actually see. I don't even know if I
And
can see.
again, what is the purpose of this?
You're good. You pull it this
So my two dots, all right, yeah.
Okay.
Same instruction or
Once he leans
procedure if
forward,
the clinic
don't
says or the
see.
doctor said, I want you to use the betadine swab first to disinfect the area or to clean the wound or the incision site, you want to do that, right? So now here we go. Without touching the tip of the
There you go.
Okay.
scissors and the forceps. Here, as you can see, it has the what?
I'm just going to be your prop here and position you.
Eric, I'm going to remove a couple of the stitches here. So where is your... Okay.
There you go.
So,
There you go.
what you do is you hold the stitch at the center.
Not tall
Yeah.
enough.
Again, before I move to see, there is that little what curve
Mm-hmm.
at the bottom of the scissors. So the one that is curved will be at the bottom. The straight will be the top. Yes.
Mm-hmm.
Okay. So you hold it at the center. Now, when you're pulling the stitch, you're not gonna pull it away from the incision site. You're gonna be pulling it towards, right? You get me? Because if you pull the stitches and pull it away, you're pretty much opening the incision or the wound. So I want to make sure that when you're lifting it up, I need my eyeballs. If you need eyeballs, you will definitely need to have eyeballs. Make sure that and then you just cut at the nut and slowly remove it, and that's one stitch. You'll be doing this a lot, especially if you work with urgent care. Hold the nut to the side, cut to the center. That's two. Yeah. Any other questions?
You have to count those two?
Yes, you have to count this too. Oh my goodness. No, you don't do it that way. I'm going to show you the bad way to do it. To make sure, oh my God, did you do that?
Take the long one.
So, no, you don't do that way, okay? So properly, be careful, making sure, and you always communicate with the patient, making sure the patient is connected with you. How is it going? You okay? Tell me if it is painful or if it's bleeding. Now, again, there's some stitches that's stuck under the tissue of the skin. Don't force it. Try to speak with the physician. Doc, it's still bleeding. It won't come up. What do you want me to do? Yes? All right. Any other questions? Sometimes, some stitches will just come off on its own and they just, you won't even find what happened. If it's what happened, there was no more stitches. There's only one left. Or in his situation, he has an absorbable one, but he didn't absorb, so he has to come in and have it removed. All right. Now, after the removal, depending on the doctor's order, if the doctor said, I want you to put some, again, remember the Tegaderm and the Steri-strips? That could be the next step that you might do before you send a patient home. So these are the basic steps, but I'm just showing you how to remove the stitches.
We don't put a stitches, right?
You don't put stitches. The doctors that's their job. That's beyond your job description to put stitches on. Your job is to assist. So sometimes in the OR, they would ask me to just hold the stitching together, and the doctor would do the stitching. Or sometimes your job would be cut the suture, not do the suturing. Are you guys with me? If you're assisting in the manual surgery, you might just be cutting. The doctor said cut, then you cut, and then you just continue stitching, cut, then you cut. That's how you're gonna. Or the doctor would say, then you cut. They don't talk to you. They just give you sign language. They'll tell you like this. That's your forceps. That means give me a my forceps. Or this. Depending on the doctor's preference. Any questions on suture and staple removal?